Knowing that I've been introduced already once more, I'm Bill Cassidy, the United States Senator from Louisiana, also a practicing gastroenterologist and hepatologist. I'd like to just thank the Urgent Care Association of America for the opportunity to address you. And I address you first as a physician. We have to take care of patients' health care needs where it is most appropriate. Urgent care clinics, your clinics, provide access to treatment in a way convenient for the patient. You know that, I know that. And this is why urgent care is one of the fastest growing segments of the healthcare industry. And as a physician colleague, I thank you for caring for our patients. Now I want to start, I'm a public policy guy. I'm doing medicine, but I'm doing medicine, if you will, in public policy. For just a minute, let's join in a discussion of that public policy. And let's review what we already know. Urgent care clinics offer a significantly cheaper alternative to emergency departments. According to your association, a visit to an urgent care clinic is roughly $180. A visit to an emergency room average costs about $1,400 with a median of around $700. There was a 2010 Health Affairs article. It was estimated that $4.4 billion could be saved if patients with minor acute fractures, strains, acute illnesses, that what you see, went to see you, in the urgent care clinic instead of an emergency department. The authors estimated that urgent care clinics could handle about 13% of all ED visits. Now, good public policy is that the use of urgent care clinics is encouraged and the use be coordinated with the rest of the healthcare system. I think my Senate colleagues understand this. For example, this year in the Senate, the National Defense Reauthorization Act included a provision that significantly enhances your ability in an urgent care clinic to provide care for servicemen and women on TRICARE. The Act authorizes a covered beneficiary under TRICARE to have up to 4 urgent care visits per year without pre-authorization. That's a good thing. Another piece of legislation in which urgent care centers may figure prominently is in the recently passed repeal of the Sustainable Growth Rate, or the SGR. In this legislation was embedded the potential to develop what are called alternative payment models. Now first, an alternative payment model, if you will, is an acknowledgement that Medicare is going bankrupt. 15 to 20 years from now, the trust fund is going to be kaput, according to the actuaries, and that the accountable care organizations set up by Obamacare are not working, at least not working in terms of saving money. One example, Kaiser Health News just reported that ACOs cost more than they save nationally after bonuses are paid. About half costs more than the care provided by a non-ACO enrolled cohort of patients. Now, I consider an ACO kind of a top-down approach. If physicians can develop alternative payment models, and integral to this will be urgent care centers. Urgent care centers, with their ability to reduce the burden on other acute care settings, to provide quality health care, generates the efficiencies and cost savings that are necessary to otherwise lower cost. Now, clearly, the more the urgent care center coordinates with primary care physicians, hospitals, and others to develop a value-based payment model that generates better quality care for patients and financial savings that are shared by all, is the degree to which this succeeds. And by the way, from my perspective, that kind of mutual system where all the providers and the patient share both in the better outcomes but also in the lower cost is the ideal. It aligns the incentives in a way which is going to improve the patient's health, the patient's pocketbook, and frankly, how the physician interacts with the patient. To me, again, this is ideal. Now, let's if you will, turn to a different but very related issue, electronic medical records. Again, another part of public policy that we're addressing right now. For urgent care settings, or maybe any setting, to be most useful, obviously you want them to be fully integrated with other providers. To be fully integrated, you have to have consistent, rapid communication of all the patient's information. To do so, makes sense, would require an interoperable and user-friendly electronic health record. What I've learned is, and I'll speak to this more later, is that health IT right now is not interoperable and user-friendly. So I'm working on legislation that would help achieve those goals, and ideally allowing a physician to be more productive, not less. Now, health IT, I think, uniquely affects you because urgent care centers treat mostly acute disease, but are not necessarily linked to the patient's primary care provider, clearly posing a challenge to patient care coordination. Now let's back up a little bit and give history on this. In 2009, Congress passed the High-Tech Act to incentivize providers to adopt health IT systems. Now the promise was that health IT would make patient care of a higher quality, more efficient, by allowing information to flow easily between different providers with better coordination of care. Unfortunately, 6 years later, the promise has not been realized. Health IT systems still largely lack the ability to speak to one another, and EHRs, in many cases, dramatically decrease the productivity of providers. As one example, in a recent study, medical interns were found to only spend about 12% of their time actually touching a patient and spent 40% of their time documenting in front of a computer screen. Instead of looking into the eyes, finding out, just noticing if the patient was following the instruction, they're checking off, have you stopped smoking? Now, I sit on the Health, Education, Labor, and Pensions Committee, also called the HELP Committee. We've heard testimony that the regulatory structure of health IT is flawed. In turn, we have a health IT system that is not interoperable nor user-friendly. So I'm introducing bipartisan legislation that will help fix this. Specifically, it reforms the health IT certification requirement, focusing on three things: meaningful interoperability, usability, and security. And the health IT product will be rated on these three things and the ratings made public. The users of health IT, most often us, the physician providers, will have a significant input into the rating system. If you find it works well, it'll be rated higher. If your productivity goes up, rated more highly. But if not, rated less highly. And if a given health IT system performs poorly and doesn't improve in a certain period of time, it'll lose certification. The goal is to establish the incentives and the accountability that ideally will drive health IT towards that better interoperability and usability, and in turn make physicians more productive and patient care of a higher quality and of greater efficiency. Now, this is related to one of the reasons that the interoperable healthcare system is important is that insurance companies and Medicare are moving towards value-based payment models. And as you know, you're there, primary care practices are increasingly partnering with urgent care clinics as part of this trend. I think the trend's going to continue, so it's our hope that these efforts on health IT coordination will facilitate this trend and make it more beneficial for all. Now let me finish by saying this. I cannot stress how important it is for you to be involved in the political process, now more than ever. We've had a pretty technical conversation today, and yet most of my Senate colleagues have not had my background, so they would not even understand kind of the difference in a highly functioning, very usable health IT system in terms of your productivity and what that means for so many other issues. You are the ones to tell them. We are in a time of unprecedented change in healthcare, whether it's the introduction of health IT, the reform of insurance or provider payment, or the unprecedented consolidation occurring among all the players in the healthcare industry. Every stakeholder has to think differently about their business model, urgent care clinics included, and the public policy makers have to know about those business models. So, Think creatively about how urgent care centers, fit into the future of healthcare, and then what you can do to inform policymakers of how it does so. If you have questions or ideas, contact me or whoever represents you. Engage in the process. It's been a privilege to be with you. Thank you again for caring for your patients. Thank you for caring about our country, and enjoy your time in Louisiana.